Fibula is the lateral bone of the leg which has upper end, shaft and the lower end. Upper end of fibula is expanded in all directions. Lower end of fibula has subcutaneous part which is directed laterally and is called lateral malleolus. So lateral malleolus must be directed laterally. Upper end is expanded in all directions. Lower end of fibula medially has triangular articular facet. Just posterior to this articular facet, malleolar groove is present. So this is my right side bone. Upper end is expanded in all directions. Lateral malleolus directed laterally. Medial to that of lower end, it has triangular articular facet and malleolar fossa posteriorly. So this is my right side bone. Fibula bone consists of upper end, shaft and lower end. One by one we are going to discuss upper end, then we will discuss shaft and then we will discuss lower end. First of all, upper end of fibula. Upper end of fibula is expanded in all directions, as you can see. Upper end of fibula bears circular articular facet. It articulates with the fibular facet present posto-inferior to the lateral condyle of tibia to form superior tibio-fibular joint. Posterolateral to that of upper end, styloid process is present. Basically, styloid process or apex of head of fibula is a projection which is present posterolaterally to the head. So this projection is called styloid process of head of fibula. Again, head of fibula is expanded in all directions. Superiorly, it contains circular articular facet that articulates with the fibular facet present posterior to the tibia to form superior tibio-fibular joint. Posterolaterally, styloid process is present. This is styloid process, a projection. Now let's discuss about borders of fibula. Fibula bone has three borders: anterior border, medial border and posterior border. Anterior border of fibula. Anterior border of fibula extends just below the anterior aspect of the head of fibula. It extends downward and finally it divides into the triangular area forming the lateral surface of lateral malleolus. This is lateral malleolus. So this triangular area is formed by the anterior border of the fibula. Again, anterior border of fibula extends just below the anterior aspect of the head of fibula. It extends downward and split to enclose triangular area forming the lateral surface of lateral malleolus. This is an anterior border of the fibula. Just medial to the anterior border, medial border is present and there is very less distance between the anterior border and medial border. Medial border terminates above the talar facet. At the lower end of the fibula, medially talar facet is present that articulates with the talus bone, and talus is a tarsal bone present in the foot. So, just medial to the anterior border, medial border is present, and there is very less distance between the anterior border and medial border. Posterior border of fibula begins just below the styloid process. As you know that styloid process is present posterolaterally. So I am showing you the posterior view. This is styloid process. So posterior border begins just below the styloid process. It extends downward and ends forming the medial margin of the malleolar groove. This is malleolar groove and posterior border is forming the medial margin of the malleolar groove. So posterior border extends just below the styloid process it extends downward, and finally it forms the medial margin of the malleolar groove. So we have discussed about three borders: anterior border, then comes medial border, medial to it, very small distance between these two borders, and posteriorly just below the styloid process comes posterior border that extends downward, forming the medial margin of the malleolar groove. This is malleolar groove, and posterior border is forming the medial margin of the malleolar groove. Now let us discuss about shaft of fibula surfaces. Shaft of fibula has three surfaces. It has medial surface, it has lateral surface, it has posterior surface. First of all, medial surface of the shaft of fibula. Medial surface of the shaft of fibula is present between the anterior border and the medial border. So between the anterior border and between the medial border, medial surface of the shaft of fibula is present, and this surface is very narrow, as you can see in the video. Between the anterior border and the posterior border, lateral surface is present. Between the anterior border and the posterior border, lateral surface is present. This is lateral surface towards lateral malleolus. Okay, this is lateral surface. Between the medial border and the posterior border, posterior surface is present. In the posterior surface, there is a ridge and is called medial crust. So if I tell you the sequence of the borders and this crust, then this will be, first of all, there is anterior border, then medial to it is medial border, then comes medial crust, this is medial crust, and further posteriorly comes posterior border. So again, first of all, there is anterior border, just medial to it is medial border, then comes medial crust, and then comes posterior border posteriorly. So we can say that this medial crust is present on the posterior surface of the fibula bone. Now let us discuss about the lower end of fibula. Lower end of fibula has following surfaces. It has anterior surface, posterior surface, medial surface, and lateral surface. Anterior surface is rough, posterior surface is grooved. Lateral surface has subcutaneous part which is called lateral malleolus. This is lateral malleolus. Medial to the lower end has talar facet, which is a triangular facet, and this talar facet articulates with the talus bone, and posterior to it is malleolar groove. This is groove. So lower end of fibula has lateral malleolus laterally, talar facet medially, and malleolar groove posteriorly.